Hello, everyone. Good evening. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India, according to study conducted across 4 Indian cities reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin conditions. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know about the management of melasma from an expert. So let's connect today with our skin expert, Dr. Grishma Habib from Hubli. She is consultant dermatologist and cosmetologist at Dr. Grishma's Skin and Aesthetic Center. This center houses all the latest devices which are FDA approved and does a wide variety of aesthetic procedures. She has more than a decade of experience and she has worked at some of the prestigious centers like Pristine Healthcare Center, Aster Hospital in Bangalore, and also VMU Medical College, Solapur. She has completed her MBBS from SDM Medical College and post-graduation in DDVL from JJM Medical College. She is also the member of IATPL. With her expertise today, Doctor will enlighten us more about melasma and its management. A very warm welcome to you, Doctor.
Thank you. Thank you for having me for this show.
So, doctor, today we are going to talk about melasma. Melasma is very common in our society, in our country, and it's mostly seen on women, though we'll also talk about men having melasma. But first of all, doctor, we would like to understand what is melasma.
Melasma is a very common skin condition that we see in our OPD, and it's a day-to-day that we see the patients. Here, it's an acquired condition where there is a dark patches which are commonly present on the face. And although it can be seen in both men and women, the prevalence rates are higher in women and those who are in the darker skin tones. Melasma can be situated on different sides of the body. Again, as I said, very common on the face. And on the face also, it's divided into 3 types. So one could be a centrofacial where, it's restricted on the center of the face, like the upper part of your eyebrows, your nose, your upper lip, and the chin. The other could be on your cheeks. That is called the malar. And the rare form is the mandibular, which is on the jawline and the chin.
Okay. So this is what melasma and this is where we normally see melasma or the patches. Now, doctor, what causes melasma? What are the factors responsible for melasma?
There are many causes, and we cannot isolate a single cause that is responsible. It's usually multifactorial. So the cause could be, exposure to UV light. Also, there are studies that says that the visible light in the spectrum of light is causing or accentuating the melasma. Then the blue light that is emitted from all of our devices, like mobile phones, televisions, and laptops. Many of them are prone to develop melasma when there is a family history, members of the family have it. That is a genetic predisposition. Very commonly, that women first see melasma during their pregnancy. So it is called the mask of pregnancy. Hormonal factors play a role. So thyroid disturbances are very common to cause melasma. Long-term use of oral contraceptive pills, or drugs that have a photosensitive potential can cause. Certain cosmetics can also trigger the onset of melasma.
Okay, so the list is really long. A lot of things can cause melasma. And doctor, the thing is, there is another word that people are more, used to. This is hyperpigmentation. We know that there is a, pigmentation, a term called pigmentation or hyperpigmentation. But then melasma is something that people by term or by word is not so used to or so familiar. So, is there a difference between hyperpigmentation or melasma, or are they the same?
See, hyperpigmentation is an umbrella term. It's a broad term that will cover under it every condition where the skin gets darker than the surrounding normal skin color. So, when you say hyperpigmentation, the hyperpigmentation could be as a result of pimples or acne that leave behind hyperpigmentation. It could be post traumatic healing process, or it could be freckles. There could be other causes of melasma, and various other conditions. Like, we have people reacting to hair dye where, the forehead is more darkened. So it's a very broad term. Melasma is a diagnostic individual condition. So melasma is one of the hyperpigmentary condition.
Okay, right. So, hyperpigmentation is a broader term, melasma falls under it. Right. And, doctor, talking about the symptoms and signs of melasma, how do we know that whatever is appearing on our skin in terms of patches is melasma?
See, usually it's not a very complex diagnosis. Usually you can diagnose it yourself. So self-diagnosable.
Mhm.
So melasma has a typical way of presentation when I'm talking in terms of the face. So it is usually symmetrical. It will come on the both sides of your cheek or both sides of your upper lip. So it's symmetrical. In many a times it's well defined. It has no symptoms, like it's not itchy, it's not burning, it's not causing you any kind of discomfort, nor is the textural lot of changes will be there. So it's just the way it presents, the common sites that it is present. It is how we identify. Sometimes, you can walk in saying that I have melasma, so like that.
Right. And, doctor, initially you said that, pregnant women are very prone to or are at risk of melasma. Are there other risk factors as well for melasma?
Yeah, the risk factors, as I said, there are certain cosmetics that we see women are using. So these cosmetics consist of photosensitive ingredients. So when they apply these cosmetic creams and go out into the sun, there is a chemical reaction. So that could lead to or trigger the melasma. Hormonal therapies for various other underlying indications when they are on long term therapies or long term oral contraceptive pills, or somebody who is going outdoors and is unprotected, uh, sunscreen. All of these put you at a risk, especially if you have a skin that's prone to develop melasma. As I said, family history of it.
Right. Many times people say that those who are diabetic or who have thyroid disbalance, are they also equally prone to have melasma?
Hormonal aspect is one of the most important aspect in melasma that differentiates it with other hyperpigmentary conditions.
Okay, okay, right. And, now, doctor, coming to the treatment part, we normally, say before we talk about the treatment, we would like to talk about the prevention part because we normally say that prevention is better than cure. Is there a way to prevent melasma?
Yeah, to a certain extent.
Mhm.
Uh, First and most important is religiously, judiciously using your sunscreen. That is one of the most important steps, and accurate coverage of the entire face. Some of us take very little amount and just dab the area. Or, we apply the sunscreen in the morning and say that I'm good to go for the whole of the day. That's not the case. Reapplication is equally important. So sunscreens, yes. Apart from sunscreens, if you're going outdoors during the peak sun hours, use a form of physical protection, whether it's a hat or an umbrella. That would, add the benefit. If you're on long-term oral contraceptives, try to switch to some other alternatives. If you are on particular drugs that are triggering it, if you have option to switch to other molecules, that would be beneficial. And don't exfoliate excessively.
Okay. Right. So we can do these things to prevent ourselves from melasma. But the very first thing that you said, that religiously apply sunscreen regularly. Now the thing is that 67% of population in India is still not using sunscreen, and they have a number of complaints regarding or excuses for not using sunscreen on a regular basis. They'll say that it makes my skin very patchy or dull, it makes me sweat a lot, I don't like the white cast, or it makes my skin very dull. So, what's your take on all these excuses that normally people give regarding sunscreen?
All of these excuses are partly acceptable, but right now, today, we have sunscreen for every skin type. Back in the day, we had like A and B. You had to choose just,
Right.
we have for every skin type, whether it's a sensitive skin, an oily skin, a combination skin, or a dry skin. It's all about finding the right balance, or finding that right ingredient that suits you. So people with oily skin definitely prefer a more matte or an ultra matte. People who are in an occupation where they have to present themselves every day, so a tinted sunscreen, so that will give you a little bit of camouflage, a little bit of foundation effect, a little more confidence in getting out. People who have sensitive skin or aged extremely on the other side of the aging spectrum, you could use a physical sunscreen. People who have dry, they can use a more creamy based sunscreen. So we have, and it requires a little bit of trial and error to get the right one for you.
Right. And we can definitely seek the help of a qualified dermatologist like you or whoever is nearby our place. We can go and take advice from a dermatologist because they'll understand our skin, they'll understand our working condition, etc. And then, as per that, they can suggest a good sunscreen for us. But the thing is, doctor, whenever we go out to buy a sunscreen, there are so many sunscreens, on shelf these days, and there are so many information on the boxes, on the tubes that we go for buying, right? What are the basics? Because starting from SPF to boost star rating, etc., there are so many informations. What are the basics to look for? What are the things that we should definitely check on the box before buying a sunscreen?
One is the ingredient, first, most important. So people who have a sensitive skin, or you're choosing it for a teen girl or a younger children, then we give, you choose something which is a physical sunscreen, which is zinc oxide, titanium dioxide, or iron oxide. If you're looking for tint, iron oxide will give you a tint. This is in terms of ingredients, when I'm saying. The others, you can take the chemical octocreolane and so many others, will be your chemical sunscreens for regular use. So earlier we used to say UVA, UVB sunscreens. Now we always prefer broad spectrum sunscreens. And also, as I stated, the visible light or the blue light is also causing pigmentation or other, premature aging situations. Then we have blue light filter sunscreens also. So we have something called protection from infrared rays. So that will be an indoor sunscreen. So it all depends on your occupation, what you want to choose. Then comes your SPF. So I think for an Indian population where, we are using on day-to-day basis, a 30 SPF is sufficient. If you're going outdoors, you're going on a beach, you're going on a trek, then a higher SPF, or people who are, sensitive, have pigmentary conditions, or they're sensitive to sunlight, they have photoallergic reactions, then you go for a higher SPF. We also want a UVA protection. So that's why you have the star rating there. So about a 3 star is good.
Right. So these are the basics that we should check before going for a sunscreen. Now, as you were saying that, the application of sunscreen, reapplication, the amount of sunscreen that we are taking, to apply, how we are applying, these all play very important role. Otherwise, what we'll do, we'll take a pea size, we'll put it on our face or rub it in our palms and then apply it over our face and we are good to go. But as you said, that these things play equal role in making the sunscreen work on our skin to protect us from the harmful radiations of various sources. What is the right way, doctor? How much quantity we require to take? What is the right way to apply, and why and how to reapply? When to reapply?
First, I think a teaspoon of sunscreen is what you may need. And most of us, concentrate on the center part of the face. We are not concerned on the periphery. We've forgotten our ears, we've forgotten our neck. So it's all about uniform application, and even the periphery. Your ears are the parts of your own body. So cover the face entirely. We also see that you now the parts of the neck are missed, or parts of the dorsum of the hands are missed. So all of these are sun exposed. So you need a sunscreen in all of these areas. It needs to be applied about 10 to 15 minutes before you go outdoors, when you're going outdoors. And it needs to be reapplied every 3 hours. If you're in a gym or you've just come out of a swimming pool, then of course you need more of reapplications at a shorter time span. Today, we advise using a sunscreen even indoors when you're at home, because of all the artificial light source that we have and all the gadgets that we are surrounded 24/7. So every 3 hours, you have to reapply.
Right. So even if you are working from home, even if you are inside your home, not going out much out, or your exposure under the sun is not much, still you need to apply sunscreen and pre-application, right quantity of sunscreen to be applied on your face or your exposed body is equally important. Now coming back to melasma, this was one of the way we could prevent having melasma. And even after having melasma, you said that you should religiously keep on using sunscreen as a regular skincare routine. Now, talking about the treatment part of melasma, doctor, what are the ways that melasma can be treated with?
The first and foremost will be in topical applications. That will be a cream or a lotion application. Initially, the gold standard regime is a Krigman's formula that we call. It has a combination of hydroquinone, a corticosteroid, and a tretinoin. But today, we have wide options that are available, from simple plain hydroquinone to the safer aspects. So it could be vitamin C, your glutathione, your alpha-arbutin, your kojic acid, your glycolic acid. This could come individually or in various combinations. Apart from just the cream applications, then we have oral supplementation from vitamin C, tranexamic acid, glutathione, and other antioxidants like astaxanthin. All of these are beneficial. Coming to procedures, we have various and a huge list of chemical peels. As I said, you could go for a simple glycolic acid as a beginner, or combinations of peels which has glycolic acid, kojic acid, lactic acid, citric acid, and various. It's a whole spectrum that is available. Apart from that, are the lasers, that is the ND-YAG and Q-switch lasers. And there are micro needling techniques that have benefited in terms of melasma. So when I'm telling these stepwise, it's not that you finish topically, then finish orally, and then come. We always have an intermixed, a little bit of oral supplementation. You have your sunscreen, and all of this has to go together. So you are supplementing orally, you are applying, you're using your sunscreen, And in resistant cases, non-responsive cases, or later in your treatment protocol, a procedure may be added.
Right. We have this very common tendency in our society. I'm sure you also get patients who have done the same. They'll go to any chemist shop over the counter, get anything that will, take care of melasma as they claim to take care of melasma. And they'll keep on applying it unless and until the condition becomes very worse or out of control. That's when they'll go and contact a qualified dermat. So, using over-the-counter medication, topical medication, etc., for melasma, um, what's your say on that, doctor?
Most of them think that melasma is one condition that a friend of mine has been prescribed the same prescription I can use, or you
Right.
go across the counter and buy a cream, and the pharmacist is the right authority to give you. So
True.
most times for anything, whether it's an acne or whether it's a melasma, when you go to these pharmacies, they end up giving you a steroid.
Hmm.
And for obvious reasons, the steroid at the first few applications is going to bring down the inflammation, and the patient begins to feel fine, all right, and all the symptoms are reducing. Then they get into the cycle where they are stuck and dependent on it, and they cannot get out. Every time they try to discontinue, the skin flares up. So they think that applying is keeping my skin safe, and my pigmentation is appearing less. But underlying all of this, the skin is greatly getting damaged. The skin layers are getting thin. It's getting more wrinkly, inflamed, sensitive. So it's a horrible situation by the time you reach our OPD, and where we tell you that it's an absolute no that what you have used. Steroids, yes, as I said, in Kligman's formula, steroid is there, but this is monitored. This is applied for a very short duration in combination, maybe at a lesser concentration or a low potency steroid. So it all needs to be monitored and prescribed. Do not self-medicate.
Right. Self-medication or asking a friend or family or, doing some home remedies can actually go real bad on your skin. Don't experiment with your health or your skin. You'll end up, wasting your energy, your time, your money, and more importantly, your skin. So don't do that. Go to a dermat at the very first stage. And I'm sure, doctor, the time taken for the treatment for a person who is just have started having these patches and comes to you, or a person who have tried, tested almost everything and then goes to you, the treatment length will differ, right?
Yes. See, melasma is a chronic condition. You can't just come to the OPD, I have melasma, in 2 months, I'm going to be okay. It's a
Right.
long treatment protocol. It's very, very resistant to most of the treatments, and has a very high recurrence rate.
Hmm.
So we tell the patients that, you have to maintain. Once you have melasma, don't look or search for a cure. This is your skin. This is how your skin is prone to. So you can't just stop your sunscreen. You just can't stop maintaining your skin. You need extended time duration for the treatment, and you also equally need maintenance.
Right. Because this is a very common question that people ask, that will it completely go away? Will it permanently go away? Because the treatment many a times takes a lot of time. And as you said,
Or I sometimes, it does test your patients, because they're so used to that, 7 days and I'm going to be okay. So by the end of 1 month, they are expecting that, it's almost lightened 50%. That's what
right.
they take time.
Exactly. So do what you can do, what's in your hand. Use a good sunscreen regularly, religiously. That's very important. Also, take care of the other points that our doctor have already said. I'll take some of the questions that have been asked by our viewers. So Kalpana is here. Her question is, how does pregnancy-related melasma differ from other forms of melasma, and will it fade after childbirth, postpartum?
See, as I said, the hormonal changes that you experience during pregnancy triggers the onset of melasma. A few of them, when they begin the pregnancy, they develop pigmentation and it resolves. In few, it stays, but it's difficult to predict, whose melasma is going to resolve and whose melasma is going to stay.
Right. In pregnancy, we know, doctor, there are many, creams, there are medicines that we normally do not, suggest for a lady who is pregnant or who is lactating. Even in many sunscreens, it's written that, only use if you are pregnant or lactating, please take advice from your doctor. So, what should a pregnant lady or a mother who's lactating do, especially in case she is, experiencing melasma or having these patches? What should she do?
First is choose a physical sunscreen which has zinc oxide or titanium dioxide, because these are the safer options compared to your chemical sunscreens. The other is, we don't start off with all the tretinoin or corticosteroids. So the safer options would be to use a vitamin C or a niacinamide or an alpha-arbutin combinations. So these will be your safer bets.
Right. And ladies, if you are pregnant or lactating, please do not self-medicate or over-the-counter medication is a big no-no for you. Please consult a doctor. Please go for a qualified dermat. That's really important.
I've also seen that they share prescriptions. That a friend of mine was prescribed and I followed the same regime. But that's not the case. Every melasma is different.
Right. That's true. Because, what caused melasma in me may not have caused melasma in you. So the cause would be different. It's important to go and understand the cause. There could be an underlying medical condition as well. So it's always important to get the right diagnosis, and only a qualified dermatologist can do that for you. So please take care of yourself. There is Purvi Mehra with us, and her question is: are there any new or emerging treatments for melasma that I should be aware of?
There are a lot of new molecules, I can say. There's mequinol, there's arbutin, then there's licorice extracts, then the vitamin C's, glutathione, trinesmic acid topically. All these are new ingredients that are coming in various combinations, which will benefit melasma.
Okay. I would also like to ask you, doctor, there's also this, tendency in our society of experimenting with our skin with a lot of ingredients that we take or consume or eat. So there is a theory that works for laymen in our regular households that whatever you eat, apply it on your face. Though I have heard from doctors like you that whatever you are applying, please eat it. So what's your take on that? I mean, how, because in case of melasma, again, I have seen a lot of people going for home remedies, applying a lot of papaya, etc., on their skin, or tomato or potato juice, and so on and so forth. So, what's your take on these home remedies or experimenting with our skin?
I agree that, eat whatever you think is good for you, just eat it. Because before I go there, I'll say that, we all have this concept and this misnomer that anything that is labeled as organic or herbal is absolutely safe, is not toxic, and can never be the reason behind my skin irritation or rash. So any plant-based extracts could be equally irritant as a synthetic product. So sometimes there are ingredients that are present in your fruits or your potatoes or other vegetables that could irritate your skin, like any other form of plant allergies that we have. So it could increase your sensitivity, it could cause a rash, it could be the reason you are experiencing little tingling, burning, and sometimes could be like, excessive scrubbing. We use sugar, we use apricot, we're scrubbing and scrubbing, waiting that, the melasma is going to fade away. So excess scrubbing is going to damage the skin. And the skin is again going to heal with a post-inflammatory hyperpigmentation because you've traumatized the skin. So please eat whatever, all the healthy things that are making all the right noises, please eat.
Right. And we often say that, maintaining a good lifestyle, healthy lifestyle, eating good, sleeping well, etc., they go a long way, especially for skin. So, how good are they, or how important is our diet or, good lifestyle for preventing or treating melasma? How far they go?
See, everything that you do is shown on your face. So, you sleep less, you've not eaten well, your hormones are not stable, you're highly stressed. All of this will take a toll on your skin.
Right.
And your skin will immediately show what you're going through. So, or you have to have a balance in terms of mind and body. So, you eat well, stay hydrated, stay calm, and don't be in the rat race, and your hormones will be stable and everything will go well. So, perhaps you respond to treatment protocols much better than when you're, at a high anxious level.
Right. Doctor, these days, because markets is flooded with products, you name it, it's there, and people are, buying n number of products. They'll have like 50 bottles of regular skincare regime. They have 50 bottles to take care of your skin, and they are also experimenting with those 50 because in next 3 months the brands are going to change. There are influencers online on every social media platform, and they are influencing people. Again, people are buying and preparing their own options, etc., etc. Now, do you think, because these days a lot of people have, increased sensitivity towards sun, or they have sensitive skin, etc., do you think experimenting with products or using a lot of products, etc., can also contribute in making your skin sensitive, and especially sensitive towards sun?
Yes, to an extent, yes. Because, the influencers are talking about so many active products, so many products. Now, not every skin is identical, although two of us may not have anything on our face, but I may have an oily skin, you have a dry skin. That doesn't mean I can apply everything that somebody is telling me. Just because you are using a glycolic acid, it need not suit me. It could be an irritant to me. Just because, there's so much spoken about vitamin C, that vitamin C may not irritate anybody. It's like elixir right now that everybody has to use. No, we do see irritations to vitamin C. So all of these products need to be used based on what skin condition you have, what you are looking. I have seen 19-year-old girls coming into my OPD with retinols as an anti-aging, when I'm saying that. So why? Like why? I think, a moisturizer, good moisturizer and sunscreen is the first basic, the pillars that you start building your house. So they are not focusing there. They're just jumping on to the retinol. They're just jumping out because niacinamide, every influencer is talking about niacinamide. Of course, it's a good molecule, but do you need it? So everything has to be tailor made on what you want in your skin, what is your age of the skin, and what are your skin concerns.
You need to take account of all this.
Yeah, I think that you should see a dermatologist, because then they know at what concentration you need. Somebody may need a 6% glycolic acid, some days, and may need a 10% or 12%. So what is the point when you are over exfoliating yourself? So a dermat will be able to evaluate things better, give you a guided protocol, even if it is for a long term. So we can guide you. Or a person who's starting off their treatment on the first time as a teenager, it's the right step. Then you know what to do ahead.
Right. I'll take few more questions from our viewers. We have Ishita Jha. Her question is complete clearance of melasma possible, or is the goal more focused on managing its appearance?
You have your answer. It's management of melasma. As I said, it's chronic. There is very high rate of recurrence. So don't go hunting for a cure. Look for an appropriate management, keeping your pigmentation under control.
Right. We have Ajit Singh with us. His question is, can you recommend specific sunscreen and skincare products to protect against melasma and minimize its appearance?
Uh,
Not in terms of brands or something, but like many people say tinted sunscreens are good for people who have melasma. So something like that.
Yeah, that is what I said. If you're looking in for camouflage, if you're in a working industry where you are the face, you are going to present yourself, tinted is good. People with sensitive skin, children, geriatric age group, choose a physical sunscreen. Your regular day-to-day person, you can go for a broad spectrum, 30 SPF, matte finish is good.
Right. We have Kirti Kapoor with us. Her question is, should I avoid certain medications or cosmetic procedures if I have melasma?
Um, I don't think so. I don't think so. It depends on what procedures you're going.
Exactly. I think when Kirti, you'll go and consult your doctor, your dermat, they'll help you because they'll know what you are going through.
Contrary, wherein oh, you have melasma, I can't touch you. I don't think so. So even if there is a certain situation in which because you have melasma, we don't want to do a heat-based, energy-based situation, we have alternatives to it.
Right.
So it's a very broad line question where I can't give you a yes or no answer.
Right. And because you also said initially that family history also matters in terms of melasma. So if I have a family history of melasma in my, family, what can I do to prevent it? A, of course, as you said, sunscreen is the one, mantra to go for. But are there other things I can do?
Take good oral vitamin C. I'm a big fan of vitamin C, so I'll keep saying vitamin C and vitamin C. So I like to put my patients on oral vitamin C, and I think almost all of them. So that gives you a good antioxidant effect, a skin repair effect, and skin lightening. Again, may not take oral glutathione as an antioxidant. You can start off with other antioxidants. Astaxanthin is good. You could also start using your anti-aging creams, like maybe a little bit of retinol or topical vitamin C or glycolic acid. So these you can start using, of course, based on the type of skin you have.
And doctor, before we sum up the whole session, any take-home message for our viewers?
There's a lot of myths, I'll tell you that a few things that I've heard is one, I'm an indoor person. I barely go out. I'm at home all day. I have melasma, but I will use a sunscreen whenever I go out. That's not the case. Indoor or outdoor, use your sunscreen. The other thing is melasma is for females. Men, as a man, I'm not going to have melasma. No, men can equally have melasma. Asian men, African men are definitely more prone to melasma. People always say melasma should have started in pregnancy, but I was fine during my pregnancy, and how come I just started it now when I'm 40? It can come anytime. It need not start during your pregnancy. And then they say, I have been religiously using my sunscreen, but my melasma is still increasing. Sunscreen is not a treatment. It's a prevention. So you also need to be treating yourself simultaneously. And this is just prevention. So please don't use it as a treatment or say, as long as I was on my treatment, I used a sunscreen. But now I don't.
Right. So these are the very common myths or mistakes that we often do. Please don't do it. Take care of your skin. And that's really important. Use sunscreen. And in case of doubt, please go and consult a right person, which is a dermat, rather than going for over-the-counter medication or home remedies or asking a friend or family. Please go to the right person. They'll, direct you. Thank you so very much, Dr. Grishma. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you.
Thank you so much.
And viewers, thank you for your excellent participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay healthy, stay happy. Goodbye.